Welcome to Samba Scientific's Science Spotlight. Today, we are joined by Dr. Dave O'Connor, professor at the University of Wisconsin School of Medicine and Public Health. Today, we'll be discussing how he and a coalition of scientists are working together to study the SARS-CoV-2 virus. But before we get into the great work that you're doing, Dave, with the COVID project, I'd like to begin with a question on social distancing. We're seeing an increasingly restless American public and companies looking for ways to get back to work. I'm wondering if you wouldn't mind commenting on why it is so important to maintain social distancing and adhere to other CDC guidelines.
Sure. Thanks, Alex, and thanks for having me here today. The answer is that when viruses are spreading, there is a hope that in the long term we'll be able to have good drugs and good vaccines. But in the short term, the only thing we can control is our behavior. And we know from other viruses going back hundreds of years how we can stop the spread. And we stop the spread by not giving the virus new targets to infect. And the way that you do that for a respiratory virus like this one is to stop having people in close contact with one another. If you minimize the number of interactions people have, you minimize the number of chances the virus has to spread between people. And conversely, if you relax those too soon, you open yourself up to the possibility that the virus is going to come roaring back. So for example, if you start opening movie theaters, as has been discussed, while it might be really feel good and empowering to get back out and see a movie again, you're potentially going to be doing so at risk to yourself and others. Because one of the things that we're learning about this virus in particular is that really soon after you're infected, in the first day or two, is when your body is producing the most virus. What that means is that while you're still feeling fine, you're potentially going to be posing the greatest risk of transmission to others. So when you're the one out at that movie theater, that might be when you're at your most contagious. And it also means that when other people are at that movie theater, they're at their most contagious. And so the best thing you can do to try to keep the number of people low, to avoid overwhelming hospitals, is to keep yourselves out of situations where you have lots of people coming into contact with one another and potentially spreading the virus.
So, Dr. O'Connor, you've been researching infectious disease for over 20 years, primarily in HIV and more recently in the Zika virus. What is it about the SARS-CoV-2 that allows it to be more pathogenic to humans and unlike similar viruses?
Well, I'm glad you mentioned that, Alex, because as you said, I've been working in HIV for more than 20 years. And when I started working on HIV, we were more than 20 years into the HIV epidemic. And HIV is itself an emerging virus. It was something that when it first arrived, it was unlike anything any of us had seen before. It had not been studied intensively. There was not a whole lot of work on that type of virus, which was known as a retrovirus. And so we had to learn everything from scratch. And as we learned more about the virus, we learned that there was a lot about how the virus behaved that surprised us as scientists. And it made us take some of the things that we first thought, like that it would be easy to make a vaccine, and it proved us wrong over and over and over again. And there are some viruses that emerge suddenly that do seem to play by the rules. Zika virus is a good example. It definitely seems like for Zika virus, if your body mounts what we call an antibody response against the virus, that protects from subsequent reinfection with the virus. It also means that making a vaccine for Zika virus would likely be straightforward. And the biggest reason we don't have one right now is because by the time the vaccine manufacturing got caught up, the number of cases in Latin and South America had really declined. So we didn't have enough people to test the vaccine in. Here we are confronted with a new virus, and then again, you see the same sort of initial confidence that we'll be able to make a vaccine in 12 to 18 months, that we'll be able to develop drugs that will help. And it's everyone's sincere hope that that is the case, that we'll be able to do this. But HIV and other viruses have taught us that it's not always going to be that simple. And until we know more about how the virus behaves, until we know what sort of tricks it has up its sleeve, it's going to be really hard to be confident that any of those initial predictions that we're making are going to pan out. And so we need to be prepared, just like those of us who have been in the trenches in HIV have been working in it now for 40 years, not 40 days, not 40 weeks, but 40 years, that this SARS-CoV-2 virus is potentially going to be part of our common heritage for the next several decades. And we're in the very, very, very first minutes of that right now. So that's a hard and bitter pill to swallow. And one thing I've been thinking of a lot recently is that, when HIV came onto the scene, I was a kid in the 1980s when it really started spreading and received a lot of attention in the US. There was a major shift in sexual health. There was a major shift towards wearing condoms, wearing barrier protection for sex, because that was one thing that we could do to protect ourselves from getting the virus. Similarly now, a different sort of barrier protection with face masks can protect us from transmitting this virus to other people and getting the virus. And I think that just like we had to get over ourselves and change our sexual habits and change the sort of cultural acceptance of condoms, we're going to have to do the exact same thing now with face masks. And they're going to have to become ubiquitous parts of daily life. And it would have been unimaginable 6 months ago. But guess what? 6 months from now, I think it's going to be something that it's going to seem strange. Like no shirt, no shoes, no service, no shirt, no shoes, no mask, no service.
Fascinating outlook. So I'm curious though, how do we learn more about the CoV-2 virus? What efforts are we putting in to establish potentially a vaccine or work towards that effort?
Well, the good news is that the SARS outbreak in 2003 gave us a shot across the bow, and it made the scientific community aware of the potential for dangerous coronaviruses causing human outbreaks. And then more recently, the MERS coronavirus, which affects people predominantly in the Middle East, acted as a more recent reminder that coronaviruses could be potential major human pathogens. And so while, it was competing for oxygen with other types of pathogens that also could cause major human outbreaks. So viruses that we've never seen before, or highly pathogenic influenza, or mosquito-borne viruses that are getting transmitted in new places because of climate change. There has been a fair amount of research on coronaviruses, including the development of some of the reagents necessary to study them, as well as some of the tools that one would need to develop a vaccine. So things like figuring out how to stabilize the proteins that you would want to use in your vaccines. A lot of that work was done with SARS and with MERS. A lot of the animal models that are now being used to study SARS-CoV-2 were pioneered to study SARS and MERS. And so in that sense, we were in a reasonably good place. But in another sense, we're really starting from zero because every virus is different. And there was an old line in the TV show The Simpsons where Homer says, well, why should we vaccinate Bart for diseases he doesn't even have? And the same is true for a lot of infectious disease research. Why should we fund research into viruses that don't infect humans? Why should we fund pandemic preparedness if there's no pandemic? Well, this provides the answer to that. You do it because the cost of not doing it can be enormous when one of these arrives on the scene. And so there hasn't been the sort of full-throated research and public health investment necessary to optimally prepare us to fight off a virus like this. And you really see evidence for that in the way that we handled the early response in the US. It's easy to say with hindsight, but we made a critical strategic error in not having dramatically expanded access to testing in the big cities where there were early travel associated cases. And that's it, that mistake probably cost us not only lives and a lot of suffering, but also a significant amount of economic damage that could have been mitigated if we were able to do a better job of containing some of those early infections before they became explosive epidemics.
So I want to follow up on that point about testing. There's been, more and more reports about the limited access to testing. Is there any way that, in your mind, that we can address that issue? Is it more of an operations issue, or is it just the ability from a scientific standpoint to accurately detect the virus? Is that the challenge?
Well, I'll be honest. I actually think now that we know that so much of the viral shedding happens when people are still feeling healthy, that the emphasis on testing is a little bit misguided. I think it's essential that we have testing both for the virus as well as for antibodies to the virus. But I'm not entirely sure how that information is going to allow you to protect from transmission, again, when most people will be transmitting the virus when they feel fine, because you're not going to go in and get tested when you're feeling fine. You're not going to get tested every day. You're not going to be able to get tested every week. There's 300 million people in the United States. Even if people were tested 10 times a year, that's 3 billion tests a year. The tests aren't going to be free, no matter how you pay for them. They're not going to be universally available to everyone, no matter how you distribute them. And if they require equipment or lab infrastructure, I don't see that as a practical way forward. What's nice about tests is that they're easily measurable. It's the sort of thing where a government or a state or a public health department can say that we performed X number of tests today, and you can use that number of tests as a measure of your seriousness or your commitment to a response. And in a scenario where most of the transmission occurs after testing, knowing those test results would be absolutely crucial in trying to protect from onward transmission of the virus. It's harder to imagine how those testing results are going to be as useful when most people are going to be highly contagious before they show any symptoms. And so in a sense, I think it's a little bit misguided, but I do think that the answer to your question about why is testing so limited, it falls at the feet of a response that, again, has missed some opportunities and also has suffered from a failure of coordination. We have private sector companies, we have the power of the federal government, we have clever and inventive academic scientists, and they're working together. That's always a good thing to see, is that people are working together. But there isn't a sense of organization. There is no one national resource that is basically saying, okay, we have a budget of $10 billion and we're going to disperse this budget to these groups to do these specific tasks, and we're going to fund them well to do, test different types of approaches. Instead, what's happened is you have small groups, and in some cases companies, all sort of being frenemies and competing and cooperating at the same time, where they're competing for market share, but they're cooperating because they all have the same general goal. But that is disjointed, and it's not an efficient way of moving all of us in the same direction as quickly as possible. And so The government is the one organization, the federal government is the one organization that has the purchasing power and the heft to make that happen. And to date, it simply hasn't.
Okay, so maybe changing gears here slightly, I want to address more specifically how you and your lab and the COVID project are addressing the SARS-CoV-2. Would you mind telling us a little bit about that?
Yeah, so in the middle of January, I was visiting Cape Town, South Africa as part of an HIV planning meeting for a conference that I'm helping to organize. And while the US was focused on impeachment, in South Africa, the coronavirus affecting Wuhan, China, was the front page news. And that was on basically nonstop 24-hour news channels. It was probably taking up about half of the news coverage. And I simply had heard about it when I was in the US, but it didn't register as such a crisis until I was there. And so I started talking to some of my colleagues, both who were at this HIV meeting, as well as some of my colleagues back in Wisconsin, and said, is there any role that we might have in helping to study this virus? And one of the things that my lab has done in the past is worked on animal models where we can infect animals, especially non-human primates, with a virus and know exactly when we've infected them, with what dose, with what strain, and can follow the animals to understand how they develop disease, understand how their immune responses work, and eventually use those systems to test vaccines and drugs. And so I asked around, and no one in my close network of colleagues had really started any work on this virus in the US. And so I basically said, well, why don't we? And so we started putting together a Slack channel. And we were originally the Wuhan clan, but then we changed that once the virus moved outside of Wuhan to the COVID. And that is basically a loose network of people who are working on different aspects of understanding how the virus behaves, especially in non-human primates, though we have some offshoots into things like testing and viral sequencing. And one of the things that we're really passionate about is the idea that with the internet, information sharing is a lot easier than it used to be. During the Zika outbreak, we made a lot of data available in real time to the scientific community so that other scientists could learn from what we were doing well, as well as some of the mistakes that we were making. What are the things that we were doing poorly? Or if something doesn't work, there's no need for another scientist to redo the same experiment and get the same result. And so that's a little bit heretical because typically science gets communicated through peer-reviewed publications and presentations at scientific conferences. So the idea of generating data on a Monday and putting it out on the web on a Tuesday seemed really unorthodox. And it worked really well during Zika, so we tried to bring the same mentality to studying this virus.
So is your data then accessible to scientists around the globe through Slack or through another platform?
It's on a website. It's openresearch.labkey.com. And one of the things that's been really great is that during Zika, we were the ones who were collecting all of the data ourselves. And so it was easier for us to put the data online. So we were able to do it. For our early studies, we're actually doing in collaboration with a facility at the NIH that doesn't have as much familiarity with it. So we can basically take their Excel files or PowerPoints and share them. I mean, sharing information online in real time is something that we all do. We do it when we send emails. We do it if we share pictures on Facebook. We do it if we download The Wire from HBO back in like the day when piracy was rampant. I mean, we're good at information sharing. This is something that we do a lot. And the sort of scientific data sharing is just another facet of the same thing.
I believe HBO's The Wire is available streaming for free to everyone who's under stay at home. So hopefully y'all can check that out. It's a wonderful show. So, Dave, I want to follow up just on another thing that you had said about this. What type of information are you sharing? You said PowerPoints, images. Is this more virus sequence related, or is this in general research, maybe publications, pre-publications, things like that?
Yeah, it's actually real-time data from our animal studies is on there. So imaging, results from CT scans, PET scans, quantitative imaging readouts, information on how the animals' blood chemistries are changing over time, how their immune cell subsets change over time, as well as testing. So we are doing some alternatives to the conventional ways of testing for the viruses. Methods, we've been sequencing a lot of the cases coming into our region of Wisconsin. And so putting out the methods for how to do that, as well as the results and what we're learning from that, we basically try to open the spigot and make the stuff that we're doing available to other people, because like in Zika, we are lucky that we're able to do these things and have been working on them since January. And so by sharing with other people, not only can we share what we've learned with other people, but we can get valuable feedback from others that we can use to improve our studies. So it really works in both directions.
So going forward, what resources do you think that you would need to build out this project or get further collaboration from partners around the globe?
Well, again, as I said earlier, with respect to funding from the federal government, I think a lot of it is going to come from the scientific stakeholders, the people who are funding research, really acting as a moral authority here in making people share their information if that's something that they value. So agencies like the NIH have data sharing policies, and people have to include these when they write their grants, but there usually isn't an enforcement arm associated with them. So, there's no one's going to come from the NIH data sharing enforcement police and make you put your data up online at any point. But if there was more of a reach, then I think you would see more of this. And I think it was really heartening in an NIH videocast this week. The open real-time data sharing was highlighted as a great partnership between us and the group that was doing the work at NIH. And part of it hopefully will also come from word of mouth, and then doing, the satisfaction of doing the right thing. Without being too preachy about it, we're in an epidemic. I think sharing data is important. As my friend Esper Callis once told me during the Zika outbreak, he's a Brazilian, and Zika, as you might remember, really impacted Brazil hard. He said when the house is burning down, you don't ask who owns the fire